Hey guys, tonight we begin with something a little more toothy and not in a good way. We're diving into the gruesome, nerve rattling world of medieval dentistry. A time when teeth were pulled with iron pliers, everyone had halitosis, and anesthesia was just a strong prayer and a mug of ale. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. And let me know in the comments where you're tuning in from and what time it is for you. It's always fascinating to see who's joining us from around the world. Now dim, the lights maybe turn on a fan for that soft background. Hum, and let's ease into tonight's journey together. If you've ever dreaded a trip to the dentist, count your blessings. Because back in medieval Europe, your dentist was probably also your local blacksmith, and your checkup came with a side of screaming. Your story as a medieval dentist doesn't start with inspiration, it starts with stench. You're born in a one-room val with a dirt floor, a thatched roof, and a family who believes bad breath is simply part of being alive. No one brushes their teeth. No one has a toothbrush and soap. That's for fancy nobles and monks with skin conditions as a baby. You gnaw on hard bread crusts and dried roots because that's what's available. Teething isn't helped with chilled rings, it's soothed with beer, soaked rags, and whispered prayers. Everyone assumes crying means you're growing stronger in reality. Your gums are inflamed and your first baby tooth will likely rot before it gets the chance to fall out naturally. By age 5, you've already seen a grown man spit out a mirror during dinner and keep chewing your grandmother's stores, her pulled teeth in a pouch for luck, and your father's smile resembles a crumbling graveyard. No one's concerned, this is normal, and then there's the breath. Oh, the breath. Every adult smells like a cave full of old cheese, and regrets your friends don't notice, because they smell the same. You, however, have a sensitive nose, unlucky for you. But the first sign that you might be destined for dentistry at age 7, you watch the local blacksmith pull a villager's tooth with tongs, meant for horseshoes. The man screams, bleeds, and thanks him afterward. You ask questions, too many, so they hand you the rag, tell you to mop the blood, and suddenly you're the assistant. There's no ceremony, no oath, no official title. But that day, your path is sealed. You're the child who isn't afraid of mouths, the boy who doesn't faint at blood, the one who knows how to boil pliers and bite back nausea. Congratulations, you're now the unofficial apprentice to the Ville's least glamorous profession. Your toys are forceps. Your lessons involve pain, and your playmates are mullers dropped into bowls with a dull clink. You don't dream of being a knight or bard or even a scribe. You dream of not flinching. Next time someone screams in your face, and so begins your journey. Not with a white coat, but with a blood-stained apron and a very unfortunate destiny. Let's get one thing straight. Dental hygiene in the Middle Ages was a myth, and if it ever existed, it died, screaming sometime around the 6th century. You, the future village tooth yanker, grow up in a world where people clean their teeth with, well, nothing if they're fancy, and we're talking monastery-level fancy. They might chew on twigs or rinse with wine, but most people, they just let nature take its course. And nature is not kind to mullers. There's no toothpaste, no floss, and no idea that sugar might be bad for enamel. Mostly because enamel isn't a word anyone's heard of. The only thing sweet peasants consume regularly is misery. Though nobles do enjoy the occasional honey-laced disaster that accelerates mouth rot with regal flair, you growing up with an eye for teeth begin to notice a pattern. Everyone's breath smells like something died in their mouth and brought friends halitosis. Isn't a condition, it's a fact of life. You learn to speak from a distance. You instinctively breathe through your mouth, which ironically only makes your own smell worse. Children lose teeth young, not from age, but from accidents, infections or chewing on rocks hidden in bread. By age 10, most people already have 2 or 3 ghost teeth holes where something used to live. People accept this like they accept mud on their shoes or fleas in their bedding. There are herbal remedies. Of course, you might chew mint or rinse with vinegar if you can afford it. But mostly tooth care consists of hoping the pain goes away before it spreads to your jaw and kills you. And no one talks about the gums. Gums are just red swollen meat that bleed when touched, and that's fine. Apparently, the idea of brushing them gently with a soft bristled brush would have sounded like witchcraft as a budding medieval dentist. You begin cataloging this horror with fascination. You poke teeth with sticks. You learn the difference between wiggly but alive and dead. But hanging on, and when someone asks what you want to be when you grow up, you say someone who makes the screaming stop. Because in your world there are only two kinds of smiles, the toothless and the soon-to-be. So, how does one become a medieval dentist? Simple, there's no medical university, no dental license, no board exams. You learn by watching people suffer, and the best way to do that is by working under the most hands-on man in town. The barber surgeon, he's not a doctor. He's a multi-tool with blood on his sleeves. He trims beards, lances, boils, sets, broken bones, and amputates gangrenous limbs between breakfast and lunch. Naturally, he also pulls teeth because why not? And now you're his apprentice. You sweep the floor, you hold down screaming patients, you fetch boiling water, not to clean tools, just to look impressive. Your first week, you witness a leg amputation with a dull saw and a leather strap as anesthesia. You faint twice. But by week 2, you're holding a torch. By week 3, you're helping steady heads while your mentor yanks mirrors with blacksmith tongs. You ask too many questions, which means you're promoted to cleanup duty blood puss, teeth. Your mentor is a practical man. If it's loose, pull. He says, if it's black, pull it. If they scream, pull it faster. He teaches you that a quick extraction is better than a clean one. That infection is God's decision, not yours, and that you'll get paid more if you pretend to pray. First, there's no textbook, just instinct, superstition, and repetition. You learn to recognize which tooth will come out with a twist and which one will snap in half and leave you with a sobbing peasant and a pair of broken pliers when things go wrong. You learn the backup plan. Blame demons, blame diet, or in emergencies, blame the stars. Astrology is surprisingly popular in medical theory, especially when the abscess can't be drained and your patient starts foaming at the mouth. Sometimes you help with battlefield injuries, sometimes you assist with leeches, but your mentor always makes sure you're there for tooth days because, as he puts it, nothing humbles a man like bleeding from the face. And slowly you learn through blood, through screams, through trial and terror. You're not a healer, not yet, but you're becoming something far more essential in the medieval world, a man who can make the pain go away for a price. If you're expecting a tray of gleaming instruments lined with surgical precision, you're thinking way too modern. A medieval dentist's toolkit looks like something confiscated from a dungeon, and you're learning to use every single piece first. The pliers, thick, rusted, heavy, not made for dentistry but for horseshoes, meat hooks and stubborn nails. The handle smells of old sweat and iron. The grip questionable, but if it clamps down on something and pulls, it's considered effective. Then comes the tooth key, a twisted little crank designed to twist a tooth sideways until it pops loose. It rarely works the first time. Usually it breaks the tooth in half, which is followed by you frantically digging out the root, while your patient sobs into a burlap sleeve. You have hooks and scrapers too. One looks like a shepherd's crook, perfect for snagging stubborn fragments. Another resembles a sharpened spoon used to scoop out abscesses and pack them with moldy bread or ashes. Sterile? Absolutely not. There's also the mallet. Yes, a mallet for when the pliers fail and you need a bit of persuasion. You hold the tool against the tooth and give it a good tap. If your aim is true, the tooth pops. If not, well, the jaw might shift a little. The instruments aren't labeled. Some were once used for animal care. Others might have been fishing tools in a past life. You inherit most of them from the barber surgeon's late mentor tools. He inherited from his mentor and so on. One has a notch carved into the handle. It's either a maker's